Hey y'all, welcome back to Worn But Wild. Today I want to talk a little bit about medical gaslighting. This is a topic that I think hits a lot of people hard because unfortunately it is so common. An example of medical gaslighting would be if you know something is wrong with your body and you go to the doctor. You tell this doctor your concerns and they do not take you seriously. A lot of times, even telling you there's nothing wrong or it's just a cold. This is dangerous for obvious reasons, but many people are afraid to self advocate because, well, they're doctors and they went to school for this, right? They know more about it than I do, right? Not necessarily. Many doctors, especially men, no hate for the men, but it's just the facts, don't believe in or choose to ignore our intuition about our own bodies. To be fair, we are not always right that there's something wrong or about exactly what we think is wrong. However, self advocating is so important. I used to be one of those people. My doctor knows best. I'll just do whatever they say. Unfortunately, I have had more than my fair share of bad experiences in this area. One of the most worrisome times this happened was when I had cancer. I know you've all heard me say that I knew as soon as I found the lump that it was most likely cancer. But when it came to the doctors, it was a completely different story until it wasn't. I was very lucky to be consistently seeing a physician's assistant at the time who took me seriously. Maybe she could hear the determination in my voice, or maybe she was just one of those rare medical providers who knew to trust the patient's gut feelings. But she told me that she would put the orders in for an ultrasound and we would go from there. Fast forward to the ultrasound. The technician was a really nice lady, kind and funny, but she was the first in a series of people who tried to make me feel better. She had to enter a few things into the computer before we started, so after I told her why I was there while we were talking, she is continuously reassuring me that I'm too young to have breast cancer, that breast cancer tumors aren't painful. Mine was. She said she sees breast abnormalities all the time, and she's sure I have nothing to worry about. Things changed quickly once she started entering information into the computer. One of the questions she asked was if any of my relatives had had cancer. I thought, here we go. Up to this point, I'm just smiling and nodding my head while inwardly feeling very anxious and unconvinced. But as nice as she was, I thought my feelings were being brushed off. I told her my mom had had stage 4 breast cancer. She enters it into the computer. Anyone else? A couple of my maternal aunts. Okay, 1 second. Enter something into the computer. Suddenly, her face drops. She turns to me and says, wow, just adding your mom and one aunt to the system increases your chances of getting breast cancer by 40%. I just smiled, but in my head, I'm thinking, I know. We get through the ultrasound, which she decides is suspicious, and I move on. Next step, biopsy. I was apparently blessed with extremely dense breast tissue. Yay me. It was the same deal as the ultrasound. You're so young. It's unlikely that it's cancerous. This time I wasn't so cocky in my head though, because I spent the entire time fighting intrusive thoughts and praying that the doctor's shaking hands did not push the biopsy needle through my breast and into my chest. As time went on, I heard a lot of that, and even now, if I have to go to the ER for something, they pretend not to see that I had a bilateral mastectomy. And when they can't ignore it anymore, they say, so it was preventative? Nope, I had cancer. Oh, but you're so young. Are we sensing a theme yet? Another time was years later. I had had many failed attempts at reconstruction. So in 2024, I had one implant on my right side and my left side was flat. The side with the implant had been painful occasionally, but I just chalked it up to the weight of the implant pulling on my skin. However, one day I was getting in the shower and I noticed I had a large portion of the skin over my implant was very pink, almost red, and my pores were huge. My skin was also swollen and looked a lot like an orange peel. A little known fact in people who have not had breast cancer or had it touch their lives in some form is that breast cancer doesn't always show up in the form of a lump. There's a very aggressive form of breast cancer called inflammatory breast cancer that has different symptoms. Some of these symptoms include nipple discharge, redness, thickness, heaviness, and/or swelling, and unusually warm to the touch. An extremely common symptom in this form of breast cancer is also, you guessed it, an orange peel appearance. Over the course of a few months, I went around and around with the doctors. My PCP wanted me to get in touch with my oncologist. My oncologist wanted me to get with a plastic surgeon. My plastic surgeon is in Arizona, and honestly, how do you explain all of the months of complications, surgeries, debridements, and cleanings my other breasts needed? I finally tried to get in with a plastic surgeon in Cleveland, but no one was particularly concerned about it. I begged them to get me in for a biopsy. I sent them picture after picture through the patient portal. I marked the area with a marker to determine how fast it was growing. I tried everything in my power. I scheduled with the surgeon and got rescheduled and rescheduled. I went to the ER where they were concerned, but also didn't know what to do. Finally, the day came when I went to see the surgeon, who was still supremely unconcerned. He swore I didn't need a biopsy. And throughout all of this, I had been on antibiotics because they were also sure that it was just a skin infection. It wasn't. Finally, I said, "Can you just remove the implant?" He informed me that if that's what I wanted, he could do that. I asked if he could also take the problematic skin and biopsy it. And he said if they remove the implant, he would make sure it got biopsied. He also wanted to let me know that I would have to wait a couple of months to have the procedure because they wanted to make sure this is what I really wanted. I was absolutely stunned. They had not done anything to rule out inflammatory breast cancer, but they wanted me to wait months to have this skin removed? Meanwhile, I was in pain and absolutely frantic. Fortunately, because of some accident with the scheduling, they scheduled me very quickly. I had the procedure and noticed the pain went away, but they had left some of the strange looking skin. After everything was said and done, and I finally received the results from the surgery and biopsy, the answer to all of my problems was found. My body was trying to reject the implant. I had capsular contracture, where your scar tissue and skin tighten around the implant. Although it is not what I thought it was, what I was afraid it was. There had been something wrong the whole time. I was so worried that I had actually made a flash drive with all the information I thought Terry would need if something happened. Copies of birth certificates, custody paperwork, usernames and passwords for the different bills. I thought I was going to die and no one was going to do anything about it. The only thing worse than it happening to you is it happening to a loved one, especially a child. I went through this with Briella. When she was younger, around potty training age, we tried and tried and tried to potty train her, but nothing would work. I know this is common. Elias was easy. We just had to work around him stripping completely naked and climbing on the toilet like Spider-Man to go pee. I had everybody and their brother in my ear giving me advice on this one. People said, try rewards. Others said, try a chart. Some said, make it fun. And even others said that we should punish her when she had accidents. Everyone insisted that she was just holding her pee in because she didn't want to stop what she was doing to go to the bathroom until she couldn't hold it anymore. To make matters worse, she was having reoccurring UTIs. I tried talking to her and using different tactics, but something in me said something's not right. One day, she's playing outside with Elias, and she comes walking up to the house looking defeated. She walks in the kitchen and wails, I had another accident. Then she starts sobbing. And in that moment, my 4-year-old daughter said to me, I don't know what's wrong with me. I just can't stop. My heart absolutely shattered for that little girl. And I thought, that's it. We're getting this figured out. I told her there was nothing wrong with her and that we would figure it out together. After many medical professionals telling me the same thing everyone else had, I kept pushing. I can remember many trips to the express care and the pediatric ER, which is almost an hour away. One night, I was driving her to the pediatric ER for what felt like the umpteenth time at 10 o'clock at night, with her asleep in the back seat, and the song See the Light by Toby Mac came on. I played it on repeat while I sobbed for her and her pain and the way it seemed like the mountains are always so high. Side note, that song has brought me through so many seasons since then. Finally, her urologist agreed to do a special test. It came back positive. Briella had VUR, where every time she peed, some of the urine would double back up into her kidney and cause UTIs and accidents. If this is relatable in any way and you want to know what real support looks like, check out today's organization, the Gracie Foundation. I love this one because what they do is so cool. If you are in cancer treatment, go to their website and fill out a request form. They will send you a box of goodies. They really get it, and they send things that we really need, like gel eye masks, fuzzy socks, turmeric tea bags, really cool notepads, lotion that's safe during treatment, among other things. You also get a book about Gracie. The website is thegraciefoundationinc.org. THEGRACIEFOUNDATIONINC.org. As much as it sucks, and we shouldn't have to, we do often have to advocate for ourselves against those who are supposed to be helping us. I've been fortunate enough since then to find a PCP who fights with me and for me and is absolutely amazing. They're out there, guys, I promise. If you end up with someone who doesn't help you or dismisses you, or you feel like you're not getting the treatment you deserve, get a second opinion or a third or a fourth. I saw 4 different GI specialists before someone finally did a scope I had been begging for months. And yes, I ended up being right. Just a heads up, at this moment, I'm not running ads unless I have to according to the platform, and I am in no way compensated for talking up these organizations. They are just out there being amazing, and I've experienced many of them myself. They are so supportive. I'm trying to keep the show as low ad as possible, but if you would like to support the show, please check out the Facebook page, Worn But Wild Podcast. I post a lot of extras and behind the scenes there. Check it out, and if you like what you see, follow me. Stay wild.